everybody. You are listening to the Medea podcast series. Medea Medical Education Academy is a global medical education provider dedicated to designing, delivering, and evaluating medical education programs worldwide. Today we are going to speak with Professor Paul Dimitri, Professor of Child Health and Consultant in Paediatric Endocrinology at Sheffield Children's NHS Foundation Trust. This podcast, Artificial Intelligence in Paediatric Endocrinology, How Does It Compare with Clinical Skills?, is part of the continuing medical education programme entitled Growth Disorders 2025, Current Challenges, Solutions and Recommendations. At the end of the podcast, learners should be able to apply good clinical practice to clinical examination and diagnosis of growth disorders, as well as discuss the role of AI and other technological advances for patients with short stature. The target audience for this program is clinicians, particularly paediatricians, working in growth disorder management and those in general practice. Some content will be of interest to specialist growth disorder nurses. All materials will be suitable for all geographic regions.
My name is Paul Dimitri. I am a Professor of Child Health Technology and Consultant in Paediatric Endocrinology based at Sheffield Children's Hospital in the United Kingdom. I'm also the Clinical Director of Innovation in Child Health Technology at the same hospital. I lead the NIHR, that's the National Institute of Health and Care Research, Health Tech Research Centre in Paediatrics and Child Health. I am also the Vice President of Science and Research at the Royal College of Paediatrics in Child Health, again in the UK.
What are the practical uses of AI in clinical practice in 2025?
So probably the best way to look at this is firstly to consider some of the general applications of AI in clinical practice, and then to delve into where AI has been used in the diagnosis and management of growth disorders. So when you consider the application of artificial intelligence generally, it's been used in clinical documentation and workflow in that there's AI-driven ambient listening tools that will help clinicians by automatically transcribing and summarizing patient interactions, and that ultimately reduces administrative burden. And in the same context, we're now using speech AI for clinical letters. So there's AI-driven dictation tools that significantly reduce the time required for the development of medical correspondence. In a different area, we're using AI in diagnostic imaging and pattern recognition. So we have AI that assists in detecting abnormalities in medical imaging. It improves the accuracy and speed and assists in the diagnosis of disease, really in early detection of the disease. Then we have AI's role in patient communication and enhancement. So we're now seeing AI-powered chatbots and virtual assistants helping patients to navigate healthcare systems and manage appointments. It's been used broadly in medicine and clinical decision support. So AI tools are aiding in clinical decision-making. That ensures better patient outcomes, but there is still the important role of maintaining human oversight, given that AI can be prone to mistakes or what are known as hallucinations. It also plays a role in precision medicine and genomics, and this is really where AI is starting to come to the fore, is really critical in supporting healthcare. So we're seeing AI-driven genomic analysis, which is advancing personalized medicine, and we're seeing that particularly in cancer treatment, but it's now starting to support other areas of healthcare as well. And on the same tack as precision medicine, we're also seeing it in personalized medicine and treatment plans, and that AI-driven algorithms are helping to tailor treatments based on individual patient profiles. And what that does is then optimize medication dosages and therapy approaches. AI has now been incorporated into medical devices, so that improves the device usability and effectiveness. And then more broadly speaking, we're seeing value-based care optimization. So AI supporting health management, risk stratification, and quality metrics tracking. So when it comes to specifically considering artificial intelligence and growth disorders, there are multiple applications by which artificial intelligence is being applied, albeit at present, a lot of this is at the research stage. So growth disorders, as many know, can have significant long-term impacts on child health and a child's development, making early and accurate diagnosis absolutely crucial. So some examples: by comparing a child's growth data against established growth charts and norms, AI can detect deviations that may facilitate the early detection of pathology that limits growth. So an example of this was a study from Finland, which used automated growth monitoring that was incorporated into their electronic patient records that employed two additional steps beyond their standard growth monitoring, which was done by nursing staff. So the first was that the longitudinal growth data for each child was automatically analyzed using an AI screening algorithm that was integrated into the electronic health record. And then secondly, any abnormal growth values identified were automatically forwarded to a paediatric endocrinologist for further review and assessment. And what this algorithm demonstrated was a nearly threefold detection of growth disorders, but it also halved the number of referrals that would have been classified as normal, and more notably detected growth failure that had previously been missed by standard growth monitoring, with an eightfold increase in pathological diagnosis. So you can see the real value there of AI in identifying growth disorders. That's also in some other research studies been taken a step further by the development of mobile growth apps that have provided a more personalized approach to facilitate the earlier identification of growth disorders. And that is because there is parental input of growth or anthropometric data that allows the increased frequency of data capture and allows this to happen in remote locations, particularly for those that have limited access to specialist healthcare. And where AI is really important is that there are algorithms embedded within those mobile phone applications that when parents input the anthropometric measurements, that algorithm can detect growth failure through predictive modeling based upon standardized regional growth charts, and then subsequently provide advice to the end user and facilitate referral to a primary care physician or a pediatric endocrinologist. Then taking other areas where there is really strong clinical application coming through is artificial intelligence facial recognition systems. And these are utilizing advanced machine learning algorithms to detect disease based upon training data of images of children that have or don't have pathology. So essentially you train up a system on normal faces and those where there are pathology to then use test data to apply to those to see if you can detect disease. So in the field of growth disorders, these facial recognition algorithms have been applied to diagnostic areas such as Turner syndrome, Noonan syndrome, and congenital adrenal hyperplasia, with these algorithms and systems achieving anywhere between 80 and 97% accuracy. And there are also more broadly commercially developed systems that can now be applied to facilitate the broader diagnosis of genetic conditions, many of which will present with short stature and poor growth. So one of the examples of these commercial recognition systems is called Deep Gestalt, which is embedded into a commercial technology called Face2Gene, which is an advanced AI-based facial analysis framework that is designed to identify rare genetic syndromes by analyzing facial features based upon 2D facial analysis. And again, this has become highly accurate over time. As pediatric endocrinologists, we're also very familiar with artificial intelligence models that calculate bone age, which can achieve a high diagnostic accuracy with the agreement reached between AI models and clinicians of around about 4.5 months. And this is already highly accurate. And there are more sophisticated AI models that are becoming even more accurate in determining bone age. And more recently, we've seen AI models called convolutional network models that have been applied to accurately assess bone age in children with skeletal dysplasias. That platform is called Deepplasia. And this is actually open source, so it's available for open use, and it applies a deep learning approach designed for bone age assessment that has been specifically validated on patients with skeletal dysplasias. So those are just some examples where we are seeing the practical use of AI in clinical practice, both broadly and also in pediatric endocrinology. And there are still going to be more to come. This is a field that is expanding rapidly, and I'm sure we'll see many more sophisticated applications in the future.
Can you give some examples of where AI can augment clinical practice?
I think this question is probably best approached by understanding how AI can support clinicians in the management of growth disorders. So I've already spoken about the use of AI in aiding the identification of poor growth and how AI models aid in diagnosis. But there are other ways we consider how AI can support clinicians. We're all aware that there is an electronic, fully automated growth hormone delivery device that is currently available to patients requiring growth hormone therapy that has been engineered with an integrated connectivity such that the device systematically records detailed injection data, including the time of the injection, the dose given, and the frequency of which that injection is given. And what that then does is transmit the data via wireless channels to a secure centralized database. What that device and system does is allow us to longitudinally monitor treatment adherence. What that therefore does is inform timely personalized clinical interventions for those that are potentially poorly adherent. And so that's the use of the data at a kind of clinician to patient level in terms of monitoring poor adherence and being able to clinically intervene with conversations and patient support, either directly or through patient support programs, to improve adherence to an optimal level. But on a wider scale, those devices also collect data that can then be federated into large data sets by which AI can then be applied to develop prediction tools for adherence to growth hormone therapy based upon a population group of data. So to give an example of that, a machine learning platform has been used with real world data from nearly 11,000 children using this connected auto-injector to develop an accurate model to predict how likely a child's adherence will be based upon an optimal threshold of 85% adherence. So what this platform does is predict how likely a child's adherence will be over the following 3, 6, and 9-month data based upon data from the first 3 months of giving injections. And what that machine learning model demonstrated when it was applied, that deviation in adherence over the first 3 months, or an infrequent transmission of data, or not changing certain comfort settings and starting treatment at an older age, were important variables in predicting the risk of suboptimal adherence in the following 3, 6, or 9 months of therapy. But what's further important with this AI algorithm is once initial treatment phase is over, in other words, that first treatment phase of 3 months is over, that model could actually be deployed on a continuous basis. So you can take any 3-month area and apply that to the subsequent 3, 6, or 9 months to predict adherence. So we therefore have the ability to predict which patients are at risk of suboptimal adherence for growth hormone therapy and understand what are the factors that are predicting that suboptimal adherence, which supports healthcare professionals in developing personalized interventions for the patients that we look after on growth hormone therapy with growth disorders. And then thinking about advanced algorithms, they're also being employed to predict long-term growth patterns by analyzing these large data sets of pediatric growth measurements. So again, to give you some examples, machine learning models have been applied to clinical parameters of patients with Turner syndrome to predict their growth hormone therapy. And actually, the prime predictive variables for the change in the height standard deviation score during the first year of growth hormone therapy for Turner syndrome patients that were taking growth hormone was their chronological age at the initiation of treatment. And then using an AI algorithm called a random forest method, that further indicated that the change in height SDS in patients with Turner syndrome on growth hormone therapy during the initial year of their therapy was the most critical predictor for subsequent 3-year height SDS improvement. And then after 3 years of growth hormone treatment for Turner's patients, it's mid-parental height and first-year increment in height SDS that has emerged as the significant predictor of long-term growth outcome by using these AI algorithms. Others have used a similar combined approach of using AI, but also taken into the analysis clinical parameters such as anthropometric measures and biochemical measures in combination with radiomics analysis. So that is AI analysis of images to be able to differentiate between different diagnoses that support growth hormone therapy. So in some studies, they've used anthropometric measurements, biochemical measures, and also the analysis of the pituitary glands using AI to differentiate growth hormone deficiency from idiopathic short stature. And the accuracy of that AI algorithm is around 80%. And lastly, thinking about the application of genomics, which I spoke about earlier. So my colleague, Professor Peter Clayton, and his team in Manchester University have utilized transcriptomics and genomics to predict growth hormone deficiency in patients, but also to predict the response to growth hormone therapy. And they've applied that transcriptomics AI approach not only to daily use of growth hormone therapy, but also to weekly growth hormone therapies as well. And they've applied that to patients with growth hormone deficiency and to patients with Turner syndrome. So generally speaking, there are, again, a lot of tools that can be used to support clinical practice, to help clinicians manage patients with growth hormone disorders and to manage them not just in terms of their investigation and diagnosis, but also their treatment with growth hormone therapy as well.
Will AI eventually take over diagnosis and treatment of children of small stature?
So I think the answer to this question is really about thinking of some of the current challenges associated with the use of AI and thinking where its limitations are, such that we view this not as taking over the diagnosis and treatment, but augmenting and supporting clinicians with the diagnosis and treatment of children with small stature. So firstly, we have to think of pragmatically in what AI systems do. AI systems learn to make decisions based on training data. And the challenge with training data is it's often biased by the fact that much of that training data may have been influenced by human decision making. And what that data may then do is reflect historical or social inequities that lead to under or overrepresentation of specific patient groups. Inherent in that process is the size of the data set as well. So some of the data sets that we use in AI, and particularly in areas such as paediatric endocrinology, where we deal with rare diseases, some of those data sets may be particularly small, or the data may have to be extrapolated from adult data sets, which therefore may introduce inaccuracy or bias into the AI decision-making process. And so what we need to do with these AI training sets is to make sure that we federate data from multiple different sources to make them big enough to provide an appropriate data set to support the AI algorithms that we use in testing or diagnosing patients with growth disorders. We also need to ensure that the outputs from AI models are applicable to the population of children that we care for. So AI models should be trained on diverse and representative data sets to mitigate the biases that arise from skewed or limited training data. And as mentioned previously, this is particularly important in children with growth disorders whereby diseases are rare and patient cohorts are small. The last issue with AI, and this is where humans are really important in what it's termed in the AI world as human in the loop, is that AI can produce inaccuracy, what's known again in the AI world as hallucinations. So it's important that we check what comes out of AI models because it's not always correct. And I would encourage you to use AI platforms such as ChatGPT or Copilot to see what happens, because you can actually see hallucinations happen where the outputs are inaccurate. So we need humans to check this data. And so from a clinical perspective, AI should really be seen as a means of supporting clinical decision-making in the diagnosis and treatment of children with short stature, not taking over. Importantly, in the context of paediatric and child health, we must think of children not simply as biological models, but they have individual needs and they also have individual vulnerabilities. And those are considered in the context of family relationships and dynamics. It's hugely complex. So we mustn't think of children just in terms of a disease, but the context and environment in which that disease is presenting and how that disease is managed in that same context. AI will not necessarily assess that context. It will give you a data-driven answer based on the data that it understands. So it will not understand the nuances of individual needs, vulnerabilities, and family relationships and dynamics. We also must consider the quality of the doctor-patient relationship, and that is based on human interaction. It's so fundamental in what we do. And what that does is seek to create a feeling of commitment and trust in the patient towards their treating clinician. That sort of commitment depends on the empathy and clinical skills of the clinician, and that yet cannot be created by AI. I mean, there is a study that has shown that AI can be empathetic, but empathetic on a digital basis, on a speech or text-based platform. But empathy and clinical skills are so much more than text or voice-based platforms. They are about human-to-human interaction. It's about visual skills. It's about auditory skills. It's about understanding the needs of your patient from the visual clues and the auditory clues from that particular consultation. And there are nuances during history taking. We gauge emotion, we make eye contact, we read body languages, we pick up additional information to reveal other issues that may be missed by an artificial intelligence program. So given that AI systems are dependent on training data, if a patient with a specific problem presenting to a paediatric endocrinology clinic, if they go through their clinical history and that reveals another issue that's related to either physical or mental health, an AI platform that has been trained on specific data may not be able to understand those issues because there is no training data there to inform the model. So what we do in a consultation is we actually go broader than the issue that we're trying to deal with. So we pick up again those nuances, those differences, those areas that may not be related to pediatric endocrinology, but may help us on that diagnostic path, but also more broadly to support the holistic care of the patient, both for their physical health and their mental health. And there are also subtle changes relating to initial endocrine diagnosis or the progress of a clinical condition that may not be identified by an AI model because the training set just hasn't incorporated the data related to those subtle changes. So really, when you think about AI in terms of its interaction, what it can do is recognize patterns, but it can't gauge emotion, it can't gauge instincts, and it can't understand psychological variations or human emotions such as doubt, fear, suspicion, or confidence, which is really important in that clinician to patient interaction. And then finally, just thinking the process of clinical examination, we use vision, we use touch to evaluate a child's presenting signs. So what we do there is we use things that AI tools haven't got to get a greater clinical view and picture of what's happening with our patients to reach a diagnosis, but also to holistically support their care as they move forward with their therapy for their growth disorder.
What take-home messages do we have at the end of this podcast?
So I think the way to sort of bring this together was from a paper by Eric Topol. He published a paper in the Lancet, and he considered the value of AI in the context of what he defined as restoring the essential humanness in medicine, primarily by providing the gift of time. So what that means is that AI creates opportunities for clinicians to focus on compassion and empathy by using AI to improve diagnostic speed, to provide the much needed time that we need as clinicians to focus on the value patient, caregiver, and doctor relationships. So AI is a facilitatory and supportive tool. I don't believe it will replace the clinician to patient interaction in either now or in the near future. In essence, AI is a vital tool to support the management of treatment with growth disorders, and it is fundamental now to support clinicians in their day-to-day practice, but it will by no means replace doctors or other healthcare professionals. However, it is likely that clinicians that do not embrace AI opportunities will be at a disadvantage in the future. So it is really important that my clinical colleagues and healthcare professionals embrace AI for what it can do, but also recognize its limitations and understand that it will not replace the clinician-patient relationship and the value of a clinician in supporting the best healthcare for children and young people in the diagnosis and management of growth disorders.
Thank you for listening to this Medea podcast. For more information about our continuing medical education programs, please visit our website at medeaacademy.com.